Okay, so let's talk our application of diathermy. So, diathermy again has some benefits to us versus our other ways of heating our tissue. And one of the big one is if you have skin that is really sensitive or soft tissues that are sensitive and can't have pressure on it, like a heat pack would or the ultrasound head would, the drum actually sits above. And so that's really nice for the tissue. Tissue temporize in tissues greater than those 2 centimeters beneath the skin. We have non-thermal effects in a larger volume as well as deeper tissue. We can target those deep tissue increases again over a large volume, so that helps with our goals usually of our treatments. Areas with moderate subcutaneous fat and deep muscle can be targeted. Again, we just need to be aware of kind of how thick that adipose tissue is so that we can alter our settings. We can do it over irregular or uneven joint surfaces since we don't have to be making constant contact with like the ultrasound head or even with our hot packs that got uncomfortable over those more superficial and bones and irregular shaped surfaces. We can really use diathermy very nicely over those. And we can really heat up those joint capsules before stretching or joint mobs, which helps increase range of motion. We get that increased stretch window that allows us to do a little bit more work. So, you know, a lot of promising results with the relaxation of the guarding, decreased stiffness. We get the increased extensibility of collagen fibers when we target that vigorous heating. So it's good for like frozen joints. So it's always, if you have access to this, and we're going to talk joint mobs next, you almost always want to kind of heat up the tissue either actively or superficially or with ultrasound or diathermy if we can before we do those joint mobs if we're really trying to do the type of joint mobs to elongate the tissue. So our treatment dosages, the dosage techniques and protocols are usually generator specific. So you'd really want to look at your particular manual and set up your modulation from that. Some of them are kind of like those new ultrasound units that we talked about where you could actually set what you want your tissue temperature increase to be and the depth of your tissue versus having to set your watts and everything. Other ones, we're going to set our pulse rate and our pulse frequency or our average power output in order to make those targeted effects. So the amount of heating is going to be based on the method of application, if you're capacitive or inductive, the size of your electrodes or your drums, and the distance from the source of the energy to the tissue. So that's going to be how you place your drum or electrodes as well as the layer of adipose tissue involved. So this chart should look familiar from here over. This is just our heating chart, right? So with a 1 degree, 2 to 3 degree increase or 3 to 4 degree increase, these are the effects that we can get. So this was our same kind of ultrasound chart that we had, and we have our non-thermal effects. Over here are our settings. So again, with short pulse widths and short pulse rates or frequencies, we mainly target our non-thermal. As we increase, we could do a kind of more mild heating with 100 microseconds at 800 pulses per second or 200 microseconds at 400 pulses per second, or we can kind of mix this up depending on the amount of heat that this individual is experiencing. Same again, we can set our pulse width either 200 or 400 with 800 or 400 to get our 2 to 3 degree increase, and then usually 400 and 800 pulses per second to get our vigorous, so our 3 to 4 degree increase. This is just one typical setting for our vigorous heating. So thinking about, yeah, we're going to try to target some joint contracture that we're then going to do joint mobs for. So trying to get to that vigorous heating. So our output mode, like we said, is still pulsed. We're using pulse shortwave diathermy. So we're not talking about continuous diathermy, but we can still get these vigorous heatings even with our pulses. So we get our duration of about 400 microseconds. We get our frequency at 800. So this one is just calling it burst because it does create that burst train. The machine automatically does that when it's in pulse mode, and most of our diathermies are. So this one's just calling it burst. So again, machines might call it pulse frequency or pulse rate and pulse duration or pulse width. Other machines might call it burst, but they mean the same thing. The inner burst interval usually gets preset for us. So in this case, this particular study had it at about 850 microseconds, which again is actually longer than our on time, okay, which we mentioned. The output intensity, kind of the amplitude, we get about 48 kind of watts per burst, which we know we had to be above 38 in order to thermal heating. So the instrumentation that we have, so diathermies vary so much, okay, and what the machine looks like. So again, you're going to have to use your own manual and kind of understand your settings, but most of them have typical instrumentation. So just a couple of warnings first. We don't apply shortwave diathermy while doing any other modality. You know, we don't put heat or ice on. We're not trying to do E-stim and shortwave diathermy. We're not doing ultrasound and diathermy. In fact, we usually don't want any of our other medical equipment within about 40 feet of the diathermy unit. So usually the diathermy is in its own separate room that can be metal free, so that we don't have any interactions. And especially on anything that would be grounded. So other things that would be plugged into electricity or water, things that would have pipes, anything like that should be about 40 feet away. But again, each unit is going to have its own measurements, so you're going to have to look that up. So everyone's going to have a master power switch, which turns on the machine, kind of initiates the current flow to the generator as a whole. If you have two drums, kind of a dual head, two drum mechanism, you might actually have to turn on two separate. So you might have these same settings all for two different sets of controls if you have the dual head. Then you have your intensity, so also sometimes referred to as power, and that's going to adjust the level of energy delivered to the patient. So you see that in this picture over here, the power. So that's going to be your watts or your average watts. There's usually a patient interrupt switch or a safety switch. It might be a handheld thing, or, you know, telling our patient how they can interrupt the treatment if they experience any pain, burning, or anxiety. Okay. The interrupt switch should actually not be within the treatment field, so it shouldn't be laying underneath the drum or things like that. You know, if you're treating their right arm, they should hold it in their left arm, or it should be on the side of their left body. So just things like that. A pause button. So if we had to reposition the patient, or if we had to wipe away any moisture, we could just pause it without having to stop our treatment and reset it all up. The pulse rate, or the pulse frequency, that's going to set your number of pulses per second. Again, higher pulses per second are going to equal more heating. A start-stop button is usually there as well. You might also have on your machine where you can set your pulse width. So like this one shows your pulse width. Sometimes if you set your pulse rate, this automatically sets based on the power that you set. Sometimes when you set these two, this will automatically set based on what you set for pulse rate and pulse width. So usually there's kind of preset ratios that the machine will do. So you usually only have to set up 2 of these 3. Your treatment timer, so how long you want your treatment to be. Again, some of the newer machines will actually preset that based on your goals of degree increase versus your timer. But again, usually a 15 to 20 minute treatment is ideal, but you're also asking the person about the heat that they're experiencing. And then tuning. So tuning is this idea that there's a resonance between the generator's output and your body's ability to absorb that frequency. Most new machines do this automatically, so it's more manual with older machines. But what happens is you're trying to get that machine to work best with the type of tissue and that person's biochemistry, essentially. And so you position the drum or the electrode over the patient, you increase your output intensity to about 40% of the max, and then there would be this tuning button where you would adjust your tuning until the output reaches its peak, and then decrease it to wherever the person is comfortable. So tuning to the patient's comfort. And your machine is properly tuned when you would be at less than 50% of your max output. Again, most newer machines that you would be exposed to don't have you do this, but it's something that you might have to think about if you're using an older machine. So our patient prep, we want to check our contraindications and our precautions. This is going to be a big part of this, right? the first steps on here are all like precautions and contraindication stuff. So we want to ensure implanted metals are not contraindicated. So we either check the manual or the treatment protocol that you're utilizing. So if they have implanted surgical metals, sometimes that's fine, sometimes it's not. So you need to check. Remove any and all metal, so jewelry, clothing that has metal on it. Remove clothing from the treatment area, so expose the skin of what you're going to treat. You want to wash the skin, but get it super dry. Remember, we don't want any moisture on the skin. That's going to be a problem. Even the clinician should not have any metal on them. There should really be no metal within about 1.5 to 3 feet of the treatment area, and all other medical equipment should be at least 40 feet away. The patient shouldn't touch anything that's grounded or metal. So the bed or the table they're laying on shouldn't have metal in it. They shouldn't be touching any water outlets or things like that, anything that would be grounded into the ground. You want to position the patient, make sure that they're comfortable, that that area is exposed. If we're trying for that edema reduction and venous return, we want to elevate the body part. We want to lay down a dry terry cloth over the skin. And we want to make sure that we have proper spacing between the drum or the electrodes as well. So the towel helps to remove the moisture as well as help to make sure that we're not directly on the skin or on the tissue, which helps decrease the risk of burns to the area. A portion of the treatment area should remain visible though, so that we can check that the area isn't getting burned or having any sort of reaction. Again, if there is moisture that builds up, we just want to hit the pause button and kind of wipe that away. Moisture usually doesn't affect pulsed shortwave diathermy if it has less than 30 watts of power. So if we're doing our non-thermal, probably not going to be an issue. It's only when we're trying to do our thermal treatments that it's going to be an issue. You should explain to them that they should feel warmth, mild to moderate warmth. If they feel anything too hot or burning or anything else uncomfortable, they should tell you, and we will pause or stop the treatment at that time. If we're using the inductive drum, we'd want to, again, look at our instructions, but usually, again, there's kind of a folded layer of towel that goes between the body part and the drum. There's different drums sometimes that can attach to the machine, so you'd want to use the one that's appropriate for the tissue that you want to target. You're usually about a 1/2 inch to 1 inch above the toweling. The surface of the drum should be parallel to the skin surface, right? That's our cosine law. We want to get all that energy into the tissue. Otherwise, the skin that is closer to the drum will overheat. So usually the center of the drum produces the most energy, and that's where the most heating is going to occur, and then less towards the outside. So you want to kind of line that up appropriately. And then again, in your settings, you'd want to select the appropriate pulse rate for your treatment. If we're using the capacitive plate setup, then again, follow your instructions, whatever's indicated by the unit. So some want a towel in the area, some units wouldn't, but you'd want to make sure that that is appropriate for your machine. We adjust the plates so that they're parallel to the body, and now we're about 3 centimeters from the skin. We also got to make sure, down to this point, that the plates are equidistant above and below the tissue. Okay, so sometimes there's spacers that you can put, and those, are set to a certain distance, and then we remove those. But that helps make sure that the plates are equal on both sides of the tissue, because otherwise we would change where our heating most likely occurs. So to heat superficial tissues, we place the electrodes closer to the skin. To heat deeper tissues, we can increase that distance away a little bit. But, again, especially with those areas of thick adipose tissue, you're probably going to need your electrodes away from the skin a little bit further to try to get through that and down into the deeper tissue. So if we're doing those electrode setups, we connect the electrode cables to the generator and the electrodes. We choose the appropriate spacers, affix them, position the patient's the electrodes on the skin. So again, the spacers are what create that difference. So this is versus using capacitive plates or drums. We don't use a lot of electrodes in our treatment, but you might. So if your machine has these, you would have to follow your instructions appropriately. Ensure that no part of the electrode actually comes in contact with the patient's skin, hence the spacers that are applied. And you secure using rubber straps or sandbags. Again, you wouldn't want anything metal to secure the electrodes. So then our general setup. So whether we're doing inductive drum, capacitive plates, or inductive electrodes, we turn the unit on, we allow it to warm up. We might have to tune it, like I said, especially if it's an older machine. Assure that the arms and the wheels are all locked in place. So once we get them set, we can lock them in place so that they don't get bumped or moved or during the treatment. We want the patient to just lie there. We don't want them moving around because that will change where the heating occurs or where the machines. So they shouldn't move until the machine is shut off. This also means, again, this is something different for our patients, right? They can't have their phones, okay? We wouldn't be having them playing around and kind of moving around. So understand that. That's another thing to kind of explain to your patient that, you can't have your phone in the area. That's dangerous. So you just need to lie here and relax for the 15 to 20 minutes. We set our timer, again, based on our goals. Increase the intensity until the patient feels mild warmth. If we're using electrodes or the drums, if those would have to be moved, we'd want to return the intensity all the way to 0 before we make any adjustments. If it's needing to dry the area, we can usually just hit our pause, which will take the intensity to 0 and make those adjustments. Don't leave the patient unattended. We want to observe the skin regularly to make sure it's not burning and ask them if they're having any unusual sensations, and then we adjust the intensity or the pulse rate or our pulse width depending on what we can adjust on our machine as necessary. So then when it's time to end the treatment, we make sure the intensity is at 0. We shut off the unit. We inspect the skin for any burns. We record the parameters in the patient's file. For maintenance, we want to make sure that after each use, we unplug and clean the drum or the cables or the electrodes based on manufacturer guidelines. We want to make sure everything gets dry before we would use it again. At regular intervals, inspect the cords and everything for kinks or frays, and then we'd have to make sure that we calibrate the machine annually, just like all of our modalities.